Hello, and welcome to the Med Center Show. My name is Michael Prilutsky, and I'm the Chief Operating Officer of the Jersey City Medical Center, filling in for Joe Scott today. Today, we have two guests with us, Dr. Pragnesh Gadhvi, cardiology, and Dr. Tyrone Krause, cardiothoracic surgery, two members of the Heart Center at the Jersey City Medical Center. First of all, Dr. Gadhvi, welcome, and thank you for coming.
Glad to be here.
Dr. Krause?
Thank you.
Thank you. So, Dr. Gadhvi, tell us a little bit about yourself, your background, your training. We'll start there.
So I am an interventional cardiologist. Did most of my training in Chicago. After completing residency and a fellowship in cardiovascular disease at the University of Illinois, I came to New York City, and did a additional fellowship in interventional cardiology at Lenox Hill Hospital in Manhattan. Since then, I worked for a few years, and beginning of 2007, moved to New Jersey, the Garden State, and established my practice, and I've been here for the past 10, 12 years.
That's great. So you trained in Chicago and New York, but came to practice in Jersey City.
Exactly.
What made that decision for you?
Well, interesting question. I think when I was practicing in New York, there were quite a few patients that were coming from New Jersey to seek advice and consultations. And there's a growing need for advanced therapeutics. And when I found that Jersey City Medical Center offered these same modalities where I can treat these patients, I chose to establish my practice here, where the tools that we have are very capable of treating these patients without patients having to come across to the city.
That's great. So, Dr. Krause,
yes.
Welcome and thank you as well.
Thank you.
Same question to you, really. Tell us a bit about yourself and how you came to be in Jersey City.
Yeah, well, I'm born and raised in New York and went through all New York schools, NYU undergrad. Ultimately did my cardiothoracic surgery at Cornell in New York. When I graduated from there 25 years ago, I took my first job in New Brunswick in New Jersey, and I've been in New Jersey ever since. Recently, well, not so recently, but 2012, I became the chair of surgery at Jersey City Medical Center, where I've been till now, doing all aspects of adult cardiac surgery, excluding transplant and pediatrics. So it comprises valve surgery, minimally invasive valve surgery, coronary artery bypass, complex bypass cases, aneurysm surgery, and different aspects of valve surgery that are what we say now is minimally invasive, which is very small incisions for valves. But we also, as Dr. Gadhvi will talk to you about, we cover the whole spectrum of heart surgery, from diagnostic to the treatment, and from simple to the complex.
And so cardiac surgery, it's a wow thing, right? It's something you hear at parties, you know, cardiac surgery, neurosurgery. So what made you want to become a cardiothoracic surgeon?
Well, I don't know if anyone wants to do it before they really understand what it's about. I think for me, I knew I wanted to be a surgeon when I did my residency at Robert Wood Johnson. I spent 6 years there. And each year you rotate through different specialties, and you try to see what's for you, what you can do and what you like the most. And when in my second year, I did a rotation in the cardiac surgery service at Robert Wood Johnson. And I was basically felt like it was made for me, and there was nothing else that I wanted to do. And I think that's kind of, there's really no secret to how you become something, at least in my case.
That's wonderful.
Yeah.
And so let's talk about what you guys do day to day. So Dr. Gadhvi, there's so much conversation now out there about prevention, about staying healthy. Assuming that nobody truly wants to be in a cardiologist's office because there's an emergency. What are the risk factors, and how do we try to stay healthy from a heart and vascular perspective?
Sure. Well, one of the things that we know is that coronary artery disease or problems of the heart is the #1 killer, not only in the United States, but abroad. The typical risk factors that we all hear of and speak of, such as high blood pressure, diabetes, the presence of high cholesterol, smoking, whether it's a family history or inheritance patterns that cause coronary artery disease, obesity, weight gain, physical inactivity. These are all the common risk factors that actually bring about the process of coronary artery disease. So it begins with trying to control these risk factors. Easier said than done. We all know that we need to control these risk factors, but what we fail to realize is the negative impact of not controlling them, and it culminates into disastrous complications, and we see those day in and day out when we treat these patients that are suffering from heart attacks.
So what happens when the patient comes to your office? What services do you offer? What screening diagnostic procedures do you offer? Sure. What do you do with a patient that comes to you in trouble?
Well, the initial evaluation of any patient is a thorough consultation looking at what risk factors they have. We do laboratory testing to see if their cholesterol is elevated. We measure their blood pressure. We go further and use certain diagnostic tools to see if there's any evidence of damage or already early signs of stress, such as a cardiac ultrasound, looking at the way their heart is pumping, looking at the way their valves are functioning. We also go deeper and using tools such as stress testing to see patients sometimes may not feel chest pain because they don't do the amount of physical activity required to bring about the symptoms. But stress testing is a nice way for us to see if there's any micro changes that occur, whether it's a problem with circulation or whether it's a problem with irregular heartbeats and whatnot, to try to identify if these patients are at higher risk and need early treatment.
And so here you are sitting next to Dr. Krause, members of a team for the Heart Center. So how does it work where the patient needs to make a transition from cardiology to cardiac surgery?
That's a great question. I think that if you look at historically, specialties were sort of segregated from primary care. And what I feel that the modern era of medicine, it's not surprising. I mean, we welcome specialists such as cardiothoracic surgeons, vascular specialists, and we try to have a multidisciplinary approach. We know that medical therapy has evolved over the years, but what we want to do is bring about all specialists together and make the right decision to give the patient the best outcome.
So when we come back, we'll talk about this teamwork approach. We'll hear from Dr. Krause. But in the meantime, we'll be right back.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net. Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights. Your one-stop store for residential and commercial floor treatments. Carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants. All major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Good Friend Self-Storage in North Bergen, New Jersey is a fully climate-controlled facility equipped with state-of-the-art security, packing supplies, a Refer Friend program, and multiple loading docks convenient for commercial use. Located just off of Route 3 at 4301 Tunley Avenue, Route 1 and 9. Call 201-867-2444 or visit us on the web today. Good Friend Self-Storage. Let us be your good friend.
The Jersey City Medical Center. You know it for its award-winning, life-saving ambulance service. It's also your health hub, with health and wellness locations staffed with certified professionals all through Hudson County. The Jersey City Medical Center, here to help you with your healthy, here when you need us the most. The Jersey City Medical Center. Visit us on the net to learn more. Jersey City Medical Center, Robert Wood Johnson, Barnabas Health Facility. Let's be healthy together. It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. Visit us on the web at barnabashealth.org.
Welcome back. We're sitting here with Dr. Krause, Dr. Gadhvi, talking about the Heart Center at Jersey City Medical Center and what the patient should expect should they need our services. So we finished last segment talking about teamwork and transition from cardiology to heart surgery. So Dr. Krause, what does it look like from your perspective?
Well, I think it's changed a lot in the last 25 years, but I think teamwork, as Dr. Gadhvi had mentioned in the first segment, is so important in cardiac treatment. The treatment begins with medications, and then it progresses to perhaps an interventional or at least a diagnostic study to determine if there is a coronary artery problem, for example, or a valvular problem. And quite often those problems can be dealt with medically. As a matter of fact, most of them can be. And then ultimately, and Dr. Gadhvi will talk about this, about the interventional part of fixing particular valvular problems or fixing particular coronary problems. But we especially work close when he comes across a problem that he can't fix. And that's when he'll give the cardiac surgeon a call. And we'll get involved with perhaps discussing, or we have our meetings where we have joint effort put in by either the cardiologist, other ancillary care personnel, myself included, where we'll discuss the pros and cons, the risks and benefits to the patient. We include the patient in the decision. Some patients will not want surgery at all costs, and we have to deal with that. But we have a comprehensive center at Jersey City Medical Center. We have excellent nursing with the Magnet Award as long as I've been there, and Leapfrog. So I think all aspects of care at Jersey City is taken care of.
So as you mentioned, heart surgery, or certainly heart care, is a team sport. It takes cardiology, it takes cardiac surgery, but as you mentioned, it also takes nursing. And yes, we do have a magnet status at the Jersey City Medical Center. It takes quality, safety, and training. And we have a rating from Leapfrog at the Jersey City Medical Center for the last 12 rating periods.
Right.
I think under 60 hospitals in the country out of 3,000 can say that. So certainly, what do you tell your patients when they come to see you and now their life literally is in your hands? How do you make them at ease? How do you prepare them for surgery?
Well, you know, one of the biggest things that is on their mind, not so much, well, certainly the technical ability of the surgeons. They always check everyone out online, and it's easily done. We have a report card, which is put out every year with all of our data on the report card. So, and we have an excellent record. The surgeons at Jersey City. But also they want to know about what you just mentioned, the ancillary care, the aftercare, because you could do a perfect operation and you want things to go well post-operatively. And what's included in the comprehensive care is the cardiologist seeing the patient every day, multiple times a day, the nursing who are specialized in open heart exclusively, intensive care.
So the nurses, I'm sorry to interrupt, are specially trained for open heart surgery.
Correct.
And work in a special unit in the hospital that takes care only of open heart patients.
Right. There's a designated area with designated nurses that just do the, and it's a whole team from anesthesia who are fellowship trained in cardiac surgery. We have 4 members that only work with us in cardiac surgery. And the nursing in the operating room also are specially trained for open heart. So when we say comprehensive right from even to the rehab, the disposition of the patient after surgery. Some patients opt to get a little extra physical therapy before going home, and we would set that up immediately after surgery to facilitate their rehabilitation.
And so, Dr. Gadhvi, as Dr. Krause just mentioned, so you actually don't leave your patient. You still go see the patient in the hospital every day?
Absolutely. We see these patients, we've known these patients before surgery. We send them through the process of getting evaluated for surgery, and then we're seeing them each and every day during their surgery up until discharge, and then we see them back in the offices again.
And so what kind of rehabilitation services take place after discharge from the hospital?
So many times these patients go through numerous pathways. Some patients are well enough to be discharged to home directly. Some patients require the need for ancillary services such as subacute rehab or transitional rehabilitation. Some patients need cardiac rehab to improve their performance levels before they're ready to be discharged. Some patients need a combination of cardiac and neuro or pulmonary rehab, but we have all ancillary facilities available, and we have colleagues that work in these facilities so we can help the patients transition to these individual areas.
So our goal for this transition is to send the patient home and do the rehab at home, not necessarily in an institutional setting?
Well, I mean, studies have suggested that some patients with cardiac disease do benefit from cardiac rehab. So it's not always a means of trying to get the patient home, but it's trying to offer the best standard of care to allow them to have the best outcomes.
That's great. So Jersey City is one of the most diverse cities in the country.
Absolutely. That's one of the reasons that drew me into practicing in this area. We have a very, very diverse ethnic population. And as I talked about in my first segment, risk factors for coronary artery disease, what we're seeing is that over time, the number of acute heart attacks, and what I mean by heart attacks that completely block the artery, we're doing well with reducing those, but we've started to pick up on other minor or secondary heart attacks, which be it because of advanced technique, advanced diagnosis, early point-of-care testing that we have at the medical center. But at the same time, what we're seeing is that there are individual populations that have intrinsic risks that are above and beyond these traditional risk factors. And that is what Jersey City is about. So recognizing the cultural variances is very important. And I think that our colleagues here are well trained, and we communicate well enough and educate ourselves in recognizing what we need to do for these individual populations.
And Dr. Krause, how does it affect your practice, these cultural differences?
It doesn't, because we have so much help at the hospital, whether it be interpreters, cultural interpreters, all sorts of different ways of dealing with these cultural differences. And they've had so much experience with it at Jersey City Medical Center. It's not something that's a new phenomenon. They've had decades of experience with it. And I'm sorry.
No, as Dr. Krause was pointing out, I think that the important thing is that we want to improve outcomes. We want to improve quality, but I think at the same time we want to make sure that the patients are confident in that we have given them all the options. And that is what the comprehensive approach is about, and that is why we're proud to be in a situation in which we can communicate and offer the patients what they really truly deserve.
Great care, safe, quality, great care.
Absolutely.
And we'll be right back with the next segment.
Meineke Car Care, conveniently located at 700 Tunnelly Avenue, Jersey City, half a mile north of County Road. Meineke bumper-to-bumper car care. Brakes, exhaust, oil change, wheel alignments, batteries, CV joints, and so much more. First-rate service at a price you can afford. All major cards accepted. Apply for a Meineke card. Meineke, Jersey City. Stop by and let Sammy check your brakes for free.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, Retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want.
Pinto Properties, Jersey City. Shaping the workplace with state-of-the-art office spaces that address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panapintoproperties.com. Pinto Properties, building Jersey City for everyone.
And welcome back. We are here again with Dr. Krause, Dr. Gadhvi, members of the Heart Center at the Jersey City Medical Center. We'll talk now about some high-end procedures that are available at the center and what the future holds for heart and vascular disease. So, Dr. Gadhvi, let's start with you. So, the Jersey City Medical Center is currently replacing one of its cath labs. Mm-hmm. That's a multi-million-dollar investment in the future of care at the Heart Center. Mm-hmm. Talk to us a little bit about what happens in the cath lab and what future holds there.
Sure. Well, we've come a long way. In the past 50 years, the first angioplasty, which is the balloon, using a balloon to open up the artery, occurred back in 1977.
In Kansas City? Or?
Well, it was done simultaneously. The first one was done at Lenox Hill, where I trained.
Yeah.
The other one was in San Francisco in St. Mary's. But since then, 50 years later, we are at the forefront of continued innovation. In our cath lab in particular, we have our fourth generation of stents, the drug-coated stents, which is the fourth generation, which are thinner.
And I'm sorry to interrupt, and the stent is?
So the first angioplasty was done in 1977, and since then, a simple balloon to open up the artery, we felt and we knew from data and outcomes that wasn't enough. So then they made a metal stent, which is actually a metal spring-like device that we insert into the arteries to keep that artery open. Since then, we realized that that was not enough. So we went with a special drug coating on the stents to prevent that artery from developing an inflammatory response. So since the first drug-eluting stent, now we have fourth-generation stents that are thinner, easier to deliver, and allowing us to do more and more complex cases where we see the gray zone between which will require surgery and which will require angiographic procedures and intervention. We use intravascular ultrasound, which is not just ultrasound of the heart, but we can go in with angioscopes and actually image the inside of the artery to determine the composition of plaque. We have special tools that we use to measure the pressure differences between arteries and between blockages in the arteries.
And why is that important to?
It's very important because it allows us to see that if there is a lesion that needs to be truly treated or not, this can kind of help us differentiate which patients and select the patients that actually will benefit from a stent rather than putting in a stent just blindly when you see these lesions. And many of these arteries that have negative FFR can often be treated with medications and avoid stents.
Negative FFR for our audience?
FFR would be the pressure. If the pressure difference is not significant, then a stent may not be required.
And is there a fifth, sixth generation stent?
They're coming. They're coming. I think we now recently have started to see smaller and smaller stents, which in the past we were not able to treat certain arteries because of the small size. The minimum stent was as much as 2.25 millimeters. Now we're seeing stents coming out in the near future to be 2 millimeters in length.
And
which is
I'm
very
reading,
important.
I'm sorry, and I'm reading some stents will dissolve.
Absolutely. What we would like to see is that rather than leaving foreign body inside the artery, we want to see if we can actually open up that artery for a period of time, treat with the special material, and then have that stent resorb itself. So the bioabsorbable stents have shown promise, and they're coming. There are certain areas where we need to treat the artery, but they have side branches that we don't want to pinch or close. And bifurcation stents are also in the upcoming future, which are actually being used as we speak. And these will allow us to treat more and more complex vessels.
And all this is and will be available at the Jersey City Medical Center?
Majority of it is already available at Medical Center, and the new devices are soon to be coming within the next few years.
That's wonderful. So, Dr. Krause,
Yes.
what's coming up for cardiac surgery? Right now, I see some patients when I round that have large openings in their chest. They're sitting there with their red pillows.
Yeah.
What's the future holding?
Well, I think just to repeat, we do all aspects of heart surgery. So we do coronary bypass, we do complex coronary bypass, but we also do off pump. Many of our patients ask about that.
And when you say off pump, can you explain that a little bit?
Yes, off pump is ordinarily the heart-lung machine is what we use to do the bypass to keep the heart still and bloodless. And we've developed techniques over the last 20 years to selected patients not go on bypass to minimize some of the inflammatory effects, some of the complications related to the heart-lung machine. So that's so we offer the off pump. We offer conventional valve surgery, complex or reoperations, but we also, as you mentioned just now with the pillow, instead of having an incision like this on your chest, you can have a 7-centimeter incision, which is about 2 inches, and we actually measure 7 centimeters when we make the incision, and we do it either on the side or in the midline, and that's for aortic valve or the mitral valve, and then a little further down the pike, but also we've done all aspects of aneurysm surgery. So if you have a complex or even just a simple aneurysm, an aneurysm again is a dilatation of the main artery of the aorta.
It's expansion of the artery.
It's an expansion of it, and once it reaches a certain size, it could spontaneously rupture. So if you have an aneurysm, we have a comprehensive clinic that could evaluate any aneurysm. And we follow you periodically. And then last, we have a TAVR clinic. As you probably heard about the percutaneous valve placement, we don't do the valve placement ourselves just yet, but we do it at another institution. But we have a screening program so that we could selectively look at any patient and decide whether they need.
And TAVR stands for, again, this is for
It's a
audience.
transcutaneous aortic valve replacement. So TAVR, transcutaneous aortic valve replacement.
And this is a minimally invasive procedure.
Well, it's super minimally invasive because you don't even make an incision on the chest at all. It's all done in the cath lab through a catheter, as if you're getting an angioplasty or a catheterization.
So any Jersey City or Bayonne or any neighborhood patient who may need this procedure can come to us in Jersey City Medical Center to where we'll advise, we'll screen appropriately, and we'll prep that patient, and then the rehab can be back next to their home.
Absolutely.
That's great. Well, I certainly appreciate you guys joining us today.
Thank you.
Thank you for taking the time.
Sure.
We spent some segments learning about the Heart Center at the Jersey City Medical Center. Dr. Krause, Dr. Gadhvi, everything they do for us at the Medical Center and for this community. Again, thank you for joining us, and that's a wrap.